Okay, welcome. I'm very, very happy to sit here with you two for our sixth lecture of the series Atlas Exchanging Knowledge. And today with Professor Dr. Masi Mohammadi and Anja Dirks on smart health and empathic interiors, scientific research in design projects. Um, Before we start right in, I'm going to give a little context to our project and the Atlas series. My name is Miriam Dreyer. I'm the researcher of the Atlas project, and the Atlas project is an EU-funded project run by the ECIA, which stands for the European Council of Interior Architects, and is the organization that holds and represents many, many thousands of interior architects and designers across Europe through multiple national member organizations, and has recently been awarded an EU grant for a project that is called BCSP, and that stands for Building on Connections for a Stronger Profession. And it aims to promote the diversity, the strength, and the expertise that sits in the wonderful work that we do throughout the discipline of interior architecture and design. And now the Atlas, in short, how we like to call it, is a sub-project of the BCSP, and therefore part of this grand mission, and is led by Professor Graham Brooker, who's the head of interior design at the Royal College of Art in London, and myself and the working group, who are also part of this Atlas project. And it consists of two parts. It's the Atlas Exchanging Knowledge lecture series, and it is the Atlas Archive, which is about to launch on the 25th of April this year. So very, very soon. We're in the hot phase at the moment, and it'll be launched at the Substance Conference in Oslo, which is happening in Oslo, but still a hybrid conference on interior research, where we are going to share the latest up-to-date standpoints on our projects and the latest research. So feel free to sign up. Now is your chance. And we are very happy to see you there and for you to be part of the release of the Atlas Archive. And the Atlas is growing to be a large online repository of all interior activity with free access. So we're hoping it will grow into a useful tool for all academics and practitioners, collecting books, films, podcasts, talks, events, projects, materials, and many, many more, all related to interior design. So make sure to check it out once it's released. We're really hoping that it will be useful and grow into a large online tool. And these lectures will also be available on the Atlas Archive, as much as on YouTube. If you'd like to look up the last lectures that we've held, feel free to do so. You will find them on both YouTube and the Atlas Archive. And for now, for today, I'm very excited to introduce to you Professor Dr. Masi Mohammadi and Anja Dirks with their works and research. With a focus on smart health, active aging, and user-centered environments, they will share insights into the dynamic interplay between research and practice, illustrating how each enriches and informs the other. Masi Mohammadi has a PhD on smart homes for active aging, holds the chair of smart architectural technologies at Eindhoven University of Technology, and heads the Kiwi Chair of Architecture in Health at Han University of Applied Sciences in the Netherlands. And Anja Dirks is trained as both interior architect and is the owner of the interior architecture office Studio ID Plus in Utrecht in the Netherlands, and was herself from 2015 to 2020 the president of the ECIA. In her work, she focuses on the impact of design on end users and with research-driven projects. So we're very excited to have you both here with us today, and I'm looking forward to our discourse. So welcome, Masi Mohammadi and Anja Dirks.
Thank you very much.
Thank you so much.
Shall I kick off?
Yes, please.
Thank you. Thank you very much. A very good morning to you all. At least it is morning to me. I don't know. everybody's timeline, but I do have you have a pleasant time, and thank you very much to be here to listen to my dear colleague Anja and my lecture. Yeah, as you can read it on the screen, is actually about the really new phenomena in the way that we are designing. It's about how this invisible hand of artificial intelligence is becoming part of our daily lives and changing the faces of our homes, our cities, and our lives, especially when it comes to people who are rather sometimes, not in all moments, but sometimes are rather more vulnerable than what we are. And those so talking about generally about senior citizens, again, I'm putting emphasis upon the of enormous capability of this target group, but also some natural disabilities that with the time could come. And as you see it on the screen, this is the idea of mine, how we would live in 2040. In my humble opinion, we will remain living in the normal cities, normal homes, but we have an additional part. Next to virtual environment, we will have in our real environment more and more smartness to make things happen and to bridge the gaps. And that is what I want to talk about, and talk about how does it affect the way that we are, performing each and every day as professionals. So, but I wanted right away to start with asking your opinion on the matter. I do believe that our homes in the future could take care of us. They could be our informal or formal caregiver. So I wanted to know, what do you think? So I prepared the Mentimeter, and so I get that. If you please try to, go to menti.com, either using this code or scanning this QR code. So I am right now. I'm going to share the screen with you. When it comes to Mentimeter, sharing the Mentimeter screen with you. Right. If everything is all right, you are here. And now the question is, if you please, what to tell me, could, in your opinion, our houses, they could take care of us or be our caregivers in near future? Yes or no? Or perhaps you have no opinion on the matter. I don't know if there are some technical difficulties because I don't see anything, but I'm going to put it on the present modus, perhaps.
It took a while to load the question, so now I have it.
Great, great. I mean, it's a quite distance between Eindhoven and perhaps London that you are living, so somebody needs to travel as well. So, let me see. No idea how many people are in the room, Miriam, do you?
About 15.
Right.
It varies.
So we wait a couple of minutes or seconds. So at least 5 people are thinking in the same line of thoughts as I am, and I'm happy. And given the time and everything, do please, write down your opinion if you still, trying to handle the technology. But I'm getting back, with your permission, to the presentation and sharing again with you my PowerPoint. If the technology, which I rely upon, that will listen to me. You never know, that thing is about technology all the time like that. And let me see. Can you see my presentation? I do believe you can, right? Okay. Right. So, as some of you do think, I do believe that the technology is able to make our homes rather more dynamic than the living environment that we have, and that is most of the time, except that it's our castle. But it remains a static environment, and it doesn't help us with the other activities except sheltering us. I asked this question also from different professionals. What you are looking at is it's a gathering, a meeting together with about 500 formal caregivers, the nurses, but also practitioners, people who help people in the daily activities. So from the medical part of story, but also practical people. As you can see on the screen in this very session, about 50 people, a small 50 people are in the room, but the majority at the end of the day, at the beginning not, but at the end of the day, they thought, yes, the home could be my co-worker of future. That could be a place that people who are not living there, but also actively could be engaged in the daily activities of people. And that is because we are at the moment facing where we are living. It's internationally, I do believe, like that we are facing it kind of four major societal factors that are also influencing our jobs. We are all of us becoming rather more green, more older, and also smart, but also unfortunately our society, there is kind of gap, either is a social gap or I don't know, different types of background gap, but we see that inequality is becoming more formally presented in our society. And I do believe that the way that we design our homes and our cities could grandly influence these major trends. One of the trends, as I said, is that we are becoming increasingly smarter as a society. We see that living has in the past years not only opened many doors for people to experience things, and the lived experience become of higher value, but also introduced a new path in our jobs. Living environment is not anymore just physically a physical matter, but also is a spiritual matter, which we perhaps should take into account when we are designing our environment. But also we see that the technology goes beyond what we sometimes imagine as a kind of obstacle and as one kind of daily barriers. The technology could at the end open doors that we possibly shouldn't at the beginning, couldn't at the beginning think of. So it's also a lot about lots of creativity. It's about thinking in different way about the problem, and that is what we are good at it, right? So I do believe, given all these societal backgrounds, but also the capabilities and skills that we have as designers and interior designers, as architects, we can see that our future should be or will be, painted in a different way. So soon, in my opinion, our houses and streets becoming socially intelligent and adaptable living organisms that could understand and could take care of us. And that is what my research program, together with the societal organizations with whom I have the pleasure of working. So we are working on realizing, understanding, but also realizing this matter together. One of these projects is about creating this idea of house as a carer, and then how we could do that. So I started just with, as we do, from the scratch, and with my drawings and thinking and my thoughts, putting my thoughts on the paper. And I thought how the environment could guide people through the daily lives when perhaps they are, living with dementia and living alone. As you perhaps know, that the number of them is increasingly, absolutely is going higher and higher. And also we know that about 70% of these people, at least in the Netherlands, living alone, and 40 living at home, sorry, and about 40% of this 70% are living alone. So it's about large number of people who need to live alone at home, especially when they are diagnosed by dementia. So the key question came how we could do that, how we could help them in their daily lives, especially when this memory fades away, or they do not know what they are doing, and the anxiety comes or apathy starts to begin. How the technology could jump in as a kind of building the bridges, or let them remember what they were doing. For example, it's at noon, and they were trying to have a sandwich or prepare a sandwich, and then they forget what they were doing. So the home could remind them with using different sensories, abilities and capabilities of people to help them, remind them to understand what they were doing, and to remember what they were doing. It could be just like, visually a kind of a signal that it says just sandwich on the wall, or could be just the smell of the bread in the living room, or any other cue, additive cue, just like somebody who tells the person, it's lunchtime, shall we go to the kitchen and prepare the lunch? So it depends on the personal background of the people. The home could intervene and could come with a kind of intervention. So we tried to establish the living environment that we could build up this idea into the reality. So together with many organizations, and either from the societal organizations, care organizations, but also housing associations, local governments, all together we developed this building in the city of Arnhem, which became our living lab, the very first living lab. And these dots that you are seeing, these are the living labs that we have in different cities, and this is the map of the Netherlands that you are looking at. So what we did, we tried to replicate the existing homes, the normal row existing homes in the Netherlands. And so the proportion of the building, everything is just like it is. And we tried to do as if you are a senior citizen who lives in his own home, and now he wants to refurbish his building to make it actually more smart, or make it a caregiver. So we started with this, making this floor systems, but also other places of the building rather smart, using the existing technologies as you are seeing. For example, in this case, the floor system is in the floor system we implemented this tag system that the system can see who is walking and where is walking actually, and could be able to trace people. And then we started putting the visual, auditive, and other types of cues in the building, as I mentioned earlier, to understand the daily habits of these people. At the moment, we are focusing on two major activities. One is the circadian rhythm of these people, so sleeping and awake rhythm, but also the eating patterns of these people are two major focus area that we are doing a study into that. Here I prepared, we have this very small video for you to get a kind of insight in the building.
Nederland vergrijst. Ons land kent nu zo'n 280.000 ouderen met dementie en de verwachting is dat dit verder zal toenemen. Om de zorg te ontlasten werken we aan innovaties. Technologische aanpassingen die mensen ondersteunen, die meedenken, meevoelen. In Arnhem staat ons inspiratiehuis. In deze empathische omgeving onderzoeken we hoe technologie voor ondersteuning kan zorgen. Hoe een huis taken van een mantelzorger kan overnemen. Zo bouwen wij stapje voor stapje aan de empathische woning. Goedemorgen, Els. Waar ondersteuning ervoor zorgt dat mensen met dementie hun dag- en nachtritme kunnen behouden. Opstaan als dat moet. Zo worden ze ongedwongen ondersteund en houden ze het ritme van de dag. Goedemiddag, Els. Vergeet je niet te eten? Deze vorm van begeleiding zorgt ervoor dat mensen beter voor zichzelf zorgen. Hierdoor blijven ouderen met dementie langer zelfstandig wonen, met minder zorg en minder zorgen. Staan ze op tijd op, eten ze regelmatig en genoeg en gaan ze slapen wanneer de avond erom vraagt. Ervaring opdoen staat centraal in deze woning van de toekomst, waarmee we mensen straks ongedwongen kunnen ondersteunen. Want de techniek van morgen staat ten dienste van vandaag.
What I want to say is that actually, especially put emphasis upon these last two sentences. The whole building is about developing experiences and understanding the situation of the target group and developing right interventions, because we do think, I do think especially, that interior architecture is not about finishing touch of the building or even about making the buildings more beautiful. It's a kind of behavioral interface, and that is the matter that we want to decipher and we want to understand more about, especially when it comes to this rather sensitive target group. And that is now I want to know your opinion on the matter again using the Mentimeter. So if you please get back to the Mentimeter and try to give an answer to this very question. So, to what extent do you continuously consider the following aspects when designing an interior space? You can use the chat or saying out loud if there is no, clarification is needed or something is unclear. So I would be happy to give an answer. But I do see that it seems that the question speaks for itself, right? So we see that movements and orientation, the wayfinding, is one of the major matters. And then again, the daily rhythm. Indeed, as we are doing also in the empathic home or some part of a story. But this sense of control, and so when it comes to real happiness and keeping agency and also autonomy at a certain level, when it comes to sense of control, we need to work on that, or there are not projects on the matter. Do you want to explain how comes? I don't know if somebody thinks that there is a reason behind it. It's just like at the moment, the questions are so many questions. I can imagine that they are needed to be urgently answered, that you need to prioritize that. I do understand that part, but I don't know if you want to say something about it. I would be happy to give the floor to you. So,
I mean, I can only speak for myself. I rated sense of control a bit lower, for example, because I thought, at least how it came across in the video, is that when it comes to self-autonomy, it might actually interfere with it if it tells you to, when is the time to eat, when is the time to go to sleep, and so on. So I think it is a support. But when it comes to autonomous decision making, maybe I don't want to eat at the moment. So maybe it can interfere with this as well.
So Miriam, you listen always to what you hear. I'm happy to hear that. I don't think that your mom would say the same, right? Oh, it is guiding. It's not ordering, right? So if system says once or twice in two ways, one way is a very subtle way. For example, as I said, just smell of the bread, and the person doesn't react or he doesn't want to get up and wants to remain in the bed. After two times, the system shuts up. And so it doesn't say anything because it recognizes it's artificial intelligence. It recognizes the preferences of the people. At least this is the way that we are trying to design and train the system, right? So to be not intrusive, just guiding, and that is the very reason it calls guiding environment. Thank you for your very good question. So, and if I may, I will invite you to the next question as well. So, which is actually somehow in continuous of the. What we do partly is us how we see ourselves, right? So the question regards that part.
This is an either-or question.
That is an either-or question, please. But you may listen or do not listen to the rules. I do hope that the technology works for everybody and the questions are clear. Otherwise, as I said earlier, I would be more than happy to, shed more light upon the matters that you think needs more emphasis or more elaboration. So do let me know. I don't see the chat room, but I assume Miriam keeps an eye up on that.
Yeah. I think there's Q&As enabled for the attendees, so the chat room is for the participants.
Great. So as you see that the sensory developing a sensory environment for mood and well-being is one of the key matters that the people who are present in the room see as their own responsibility or their own job as interior designer. Thank you for sharing this. I'm getting back to the presentation because we want also to have this conversation with you, and Miriam has also a great story to tell. So I am keeping that short. Didn't forget the time, ladies. So to do so, at least in my personal opinion, to get things done in the future and the way that we need to, somehow integrate technology in the living environment as a reaction to a very good question of Miriam. Also, I said, one is the giving the agency and autonomy to the people themselves to decide, while the current situation, almost all technological systems that we know are automatic. So meaning there is no opinion from us as so when the light comes in the room, the screens goes down. That's it. That is how it's programmed. So we want to do that. And some other aspect is to think about merging the natural environments and the digital environment together. So back then we came up with this idea of developing eatable walls in this very building for senior citizens with dementia, to just not only talk about eating, but also they sense it, the smell of strawberry and everything which is has a gentle touch of remembering of eating, or somehow not only remembering but also somehow making you is enthusiastic to eat or stimulate your daily activities. So we tried to, in this building to get back to three essential matters. One, to get people to stay active. Second, tried to stimulate them to eat, at least hopefully eat healthily, and also continuing carrying on with their own hobbies and daily activities. So that's the whole matter that guiding environment tries to guide people through these three holy rules, as I say, because we do believe, I at least for sure do believe. I'm sorry, I forgot to translate this shit into the English. The first one says the technology or living environment, mostly up to now, it has been a kind of aid, a kind of device to help, but it could be also stimulating environments. And if we go further and we have more eyes upon giving the people the agencies which they deserve, we could certainly talk about living environment as medicine. And to do so, we need to have a kind of sense, or to develop a sense of how we are going to create a balanced combination of natural and environment, human interaction, and also the technological development. So merging these three matters together in a balanced way is the key to create empathic environments of the future. Otherwise, we are rather traditionally building the buildings which could make us healthier or not, or we are developing rather a high-tech environment. So I do believe that to do so, we need to come with more and more creative solutions that could help us to, as a kind of eye-opener, sometimes even as a kind of a statement, to understand the mindset of senior citizens, but also the implicit needs of them. It's not just about explicitly saying things. And so we need to use the technology not only to measure how they feel or what they say, or to guide them through their daily activities, but to understand also what they feel. And if we are allowed to do that, and they give us the permission to do so. So we need to have more neuroadaptive technology, which is at the moment really in development. So there is a still long way to go. But also we need to understand how context aware the technological development could be, and how they should be embedded in our environment. But the reality is like this. Today's living environment is rather disabling than enabling. So we need to build lots of things up, and to know more and more about how, what. And so there are many question marks are open, that I do believe that is this wonderful collaboration between practice and science could shed more light upon that. This all creativity of the practice and this all evidence informedness of this science could possibly avoid such an environment that we put our grandmas, granddads into these environments, and we think why they couldn't find their own room. As you see, almost nobody can. So we decided to measure this situation. So two of my PhD students, they went to three different care homes in the Netherlands, and for a certain amount of time, they remained there, and they did measurements, rather normal measurements like we are used to, just like observation and interviews and fly on the wall observations, but also they use the technology and wearables to understand the emotions of the senior citizens when they are going in this kind of type of corridors, going from A to B, or when they performing the daily activities like hobbies that in the care homes are provided, like gardening or any other types of that. And as I said, that the methodology is very variated. We can say that at the moment, based upon these two studies, two rather large studies, I would say that the environmental matters are really need to be taken into account. So what we do counts. And that is what we should also remember when we are doing that. As Heidegger, the German philosopher, said once, when you are designing a building is letting people to be, so enabling them to be. And that is what we should take that one also all the time into account. It's not just a measure of making things beautiful, but more livable. And so we see that that living environment has clearly impact on the lived experiences of the people, especially this target group. And that is the core message. And that gets me to the another key question, that how comes that we design the buildings as we design? For example, when you go to the normal nursing homes, mostly, at least I can for sure say in many different European countries that I had the honor of visiting different care homes to see them. Many of the buildings are designed like this. The key question, again in the Menti, is that what do you think? Is this true that we should develop, 50s building with interior design of 50s for this target group, or it's something that we think that everybody does that and we are also doing that? So if you please get to Menti again. Okay. The answers are still traveling towards Menti. So it depends. Okay. Oh, again, it depends. So I do love, Miriam, in the Q&A part that we get back to this one if it's possible, because this is very interesting that all depends. I can tell you, I went through it together with my colleagues and PhD students. We went through the literature. Up to now, we don't have almost any reliable source which backs this one up, while internationally we are doing that. So this one is a good key question, I would say, if you agree with me, to get back to. And I'm finalizing my talk. Okay. Right. So what we can for sure say that based upon all the studies that we have done is that the current living environment is not only, healing, but also is rather stressful and harmful when these PhD students ask the senior citizens to perform the tasks or to just walk in this corridors. They could see, based upon the wearables, they could see how stressful sometimes this daily performances were for the senior citizens. So at least for that part, we are sure, but we know it as a person ourselves also, how the buildings could be confusing, but also sometimes are not just a place that you could relax in there. So that is the matter that we are developing with each other, developing a platform with each other to understand it more and more. And that platform is Dutch Empathic Environment Living Labs in the Netherlands, which started with some care organization and housing association collaborating with some universities, and now actually in this couple of years it has been developed a lot, and there are many different projects and trajectories that we are working on that in our country, but also together we have the honor of working with our European partners. This is again the map of the Netherlands. The dots are the living labs, and if I want to summarize, there are two types of living labs that we can talk about, that we are working on that. One is regards the matter of independence independence and self-reliance, just like House as Carer, as you said a couple of minutes ago. But some projects are upper part of the picture, as you are seeing, are more based upon collaborative management and how we together as a society could work upon that. And matters like encountering public familiarity and that kind of stuff are being part of the story. And this is a longer story about these trajectories and upper parts, so it can mention many things, but the time is up. Mentioning this matter that we try together understand more and more, develop more understanding about the conditions and mechanisms that are needed to make people healthier, happier, but also to understand how we can develop more typologies, more technical, but also social solutions of the matter. But also we want to understand what is the impact of these interventions or the existing interventions on the quality of life of the senior citizens. For this reason, we work very closely with, different care organizations, housing associations to develop ideas just like empathic neighborhoods, but also, developing ideas for bringing people together and more citizen science technologies to develop, or environments to develop that gives the people is saying about their own lives and their own environment, as the matter shows. Thank you very much, and I leave the floor to my dear colleagues.
Yeah, Anja, if you'd like to share a bit of your work and how you apply the research into your design process, I think this would be a great addition to the research that we've now heard from Masi, and how the interplay works for you in the practice. That would be very interesting.
Yes, I will do indeed. We have a mutual common ground on the topic of aging and elderly, and also how the environment can affect it. I prepared a couple of slides, also to debate a bit on the topic itself, and indeed how research work influence daily practice, and how research can be implemented in projects in daily practice. I will share, let's see.
Are you sharing it?
I'm trying to.
When it comes to technology, you never know.
You never know, indeed.
Right.
So here it is. So there are two main topics that I want to share with you, in addition to what Masi just explained us about the whole project she's working on and the work she's doing. The one key element is research-driven design, research as a foundation of design. It probably has to do also with my own background. I've been trained as an interior architect in the Art Academy in Utrecht, and as an architect at the Technical University in Delft. So what I learned from the Art Academy is designing from more as a designer base, but I missed the research part. So for me, it was also about aesthetics and user-centered design, but I missed a bit the why in the design, but also how research could actually help giving us a good foundation and make it non-questionable anymore. So it's beyond aesthetics, as we say. In Delft, it was much more about research-driven. Somehow I sometimes missed the more designing part in it. And it was much about urban context, building envelope, and then the end user of the building sometimes kind of were overseen, especially when there were end users with special needs. So we just heard in the talk of Masi, she talked about aging society, also people with dementia. I will dive into that a bit as well as an explanation. The office is working on much broader projects, also on education and dwelling concept. But for this part, I focused on healthcare and especially also designing for elderly to make it more concrete. So what we did as a studio, this year it's 15 years. We focused on independent research lines. So we do independent research to see how it affects daily practice and design projects. And we do it separately because it has a different pace. So you see that research is kind of slow, needs patience, is very precise, and just needs the time, and is also ahead of the project that we're currently working on. And in the project, they're kind of driven by deadlines and the daily things going on. And even our clients have some trouble to find the 5 to 10 year perspective. So what Masi was always also talking about, implementing maybe technology. These are things that are too far ahead for them. And this is about technology, but they're kind of struggling already with the daily life. So it's hard for them to see. So by doing the research, we're able to be a good conversation partner for our clients as well, to talk with them about the future and to see how buildings can actually apply to the future as well.
I do believe that your slides are not really working. At least I see the very same slide.
Yeah, that was true, because now you probably see a different one, right?
Not yet.
No. We see the cover page, the Atlas archive.
Okay. That's interesting, because I see myself changing the slides. Let's see how this will work then. Try it again. You seeing a different one now? Okay, perfect. And now? Also? Okay, good. I don't know. It's a good explanation how technology sometimes get the best of us. Well, Masi already showed also the daily life in this time caring homes for elderly that we have to deal with. So this is an older project, but I could take one of the, I don't know, 100 examples of how still a lot of nursery homes, caring homes, elderly homes would look like. And well, Masi talked a lot about also the technology part, but we're also talking about, you just know, everything else that you're seeing actually beyond the aesthetic, beyond the technology. There's a lot of things, like Masi already said, that is people rather disabling than enabling in this environment, and especially people with dementia who are highly depending on their environment, and it really affects them. Yeah, just to find their ways to oversee the things, to get orientation in time, in space, in place. It's not really helping, but it's daily reality. And what we try to do is by research, transforming these places and implement all the other things. Let's see if I can. Is this next slide coming up as well? Yellow bench, yeah. And what we also see is that there's a lot of goodwill in transforming this environment, but then still a caretaker was asking me why people would not sit on this bench, because I know they did a great job on painting the wall yellow and then placing this bench over here. But for people with loss of eyesight, or elderly people with dementia, this whole bench is not visible at all because it's kind of disappearing in the wall itself. So what we did a research of 2 years, from 2012 to 2014, together with a research partner, Marianne Wetzels, on how scientific and medical research on people with dementia and the disease of dementia could affect the design. So what would be design guidelines seen from the medical and scientific base. So that research took 2 years, and a lot of insights came in there, and one of them was contrast. So people, in order for eyesight to see something, people need contrast, and there's certain values with that as well. So that meant that in this case, the wall should have had another contrast, not particularly a different color. It could have been light, very light yellow or very dark yellow, but it's more about the contrast. So if you put it in black and white, that the bench distinguishes itself from the background. So that's more into the depth, but the guideline from this talk is mainly about that the insights of what we get from the design and from the research could be implemented in the design. This is the same project, different angle after the transformation. But you see that also here technology is implemented, but it's more in the lighting and soft technology. So not projections, but more in a day and night situation for the lighting. You see also in the background, the lighting in the wall paneling. So there's a lot of options for people to have a day and a night rhythm in the lighting. So that's the technology in this project. But it's mainly about making a human and more homey environment and taking account all the things that we learned from the research. The second thing that I named is user-centered design. So the end user of the space as a starting point of designing. This is something that from the architectural perspective that I've learned in university, it's designing the inside out method. So we start with the end user of the space, and from there starting to design also the surrounding space and the building. And it might sound naturally for interior architect or interior designers, but seen from architecture side and designing the whole building, it's a different approach. And by having this design research as a backbone and placing the end user in the central point, this is a way to go. And then we are even able to influence the municipalities or governments and convincing them that sometimes different guidelines should be in place for the building itself. So that's a good way to go if you start from research and foundation from that, and you can explain actually why certain implementation should be needed. Sometimes we even be able to restructure the guidelines from the building itself. So a second brief example I would give is about this room. This is a care organization for people with disabilities with high demands, so physical and mental disabilities. And they did a project about a couple of years ago. They started a project called Physical Environment. And in this project, they could apply the patients with the highest care amount, about 10 to 12 people. And this started because they discovered basically kind of an experiment. They had one patient that had very high care demands. So they need 2 to 1 caretaker, which is a high amount of cost on a yearly base. And they saved quite a high budget to transform his room, actually. But afterwards, he was able to have even a one-to-one person guidance and then even be part of a group. So the amount of money that was in this patient lowered extremely. And this was only by transforming this one room, which is only 20-25 square meters. But the interesting part is that it's research-based. So there's a PhD research behind this. They do start observation with ground starting points for the research, and then during the process in which the whole scope of caretakers, family onto the board is involved. Afterwards, they also evaluate the project and the behavior of the patient itself and see how design actually affects behavior and the amount of care, but also the satisfaction of the patient itself. So this is a very interesting project where basically the research, scientific research is implemented and together with design projects. I'm not able to show you the end result because it's still part of the research and they're not launched it yet. I can just give you a brief teaser, so to say, about what would be the end result a bit. But we applied soft materials or human materials and natural materials that's kind of friendly, but the whole design is based actually on observations of the patients together with the whole care group, and a way of how to transform this room in such a way that it will benefit the patients. And the very first results are quite really positive, actually. Well, to me, I think the debate or the talk that Masi and I myself can have would be really interesting as well. So my suggestion is to save some time to have this space. So therefore, I will end with a slide, which is quite new thing that we actually invented as an office ourselves. What we saw is that there is kind of a gap between the technical briefing that you usually get in a project that is involving very much the square meters and the technical outlines of a project. But it usually misses the guidelines seen from the human perspective, from the end user of the building itself. So it's saying here in Dutch, but it's a program of experience rather than the technical briefing that you usually have. And basically what it does is it sketches user profiles from different users of the building, and it explains how these different users will guide themselves through the building. And this is added to this technical brief. So it's totally the starting phase, even before starting phase of the project. It's the project definition, so to say. And we help clients with this to see their needs through the eyes of the different users of the building. So it's from a caretaker, it's from a family member, it's from a patient, but it could also be for office buildings or educational projects. It's just explaining how from the central entrance you will move towards, in this case, a restaurant, to a living area, to a living room, to the room itself, and it describes the different moments of the day. So in the middle of the night, in the early morning, or to breakfast, and it explains how somebody will experience his day and the environment they're going through and what they're actually needing. So in this way, we try to connect all the research that we have done and the technical outlines of the project with the perspective of the user and their specific needs, to be enabled to create an environment or let others create an environment, because this is not only for our own project but also for colleague projects, to show them how the end user could be a center point and a starting point, but also what are their specific needs that are probably not correctly covered all in this technical programs. So this is basically for a brief part, not to overtime everything. We're almost over time, but Miriam, I let it up to you. Might be good to have a couple of questions or have a short talk with Masi and myself about the topic.
For sure, for sure. I mean, we just encourage everybody. There's a Q&A section down in the bar below. If you have any questions, please post them, because I think it would be it's a very rich topic to dive into a discussion into. So maybe a couple of minutes, we should definitely do it, I think. I have so many questions myself, but please.
So you start with the first one.
Maybe if you want to pick on things that stood out for you in each other's works, I think this would also be interesting to see where the intersection lies.
Yeah, the good thing is then I think we're both quite familiar with the work we're doing. So, and the interesting thing is that we're so eager to see how one is affecting the other, because it's not two separate worlds. It's connecting. So to me, the technology part that Masi is investigating so deeply is really a future tool as well, but it's really hard to get it into practice. So if I compare it with daily practice, our clients are mainly talking about one specific part of the whole rights case range of what Masi was talking about, rather than integrated part. I don't know how you see it, Masi.
Jump in, Miriam, if you think differently, or all people who are listening they think differently. In my opinion, this very example that I showed is rather now at the moment is in development phase. Me myself also, together with some care organizations that we are trying to do that, we are in the process of trial and errors. We are trying to train, to understand, but also to train the system. So it's not about realizing that one into practice yet. It was about how we could go and where we could go, and how we should go there. But there are some other projects and trajectories, just like I didn't show you. For example, we together with the people who are living in the city of Eindhoven, they are rather senior citizens and wealthy ones. They are living in the neighborhood, and the neighborhood is literally divided by a canal, by a river, into two parts, and the other part is for social housing homes, and this part is for senior citizens who are living in rather expensive homes. So they came with this question, how we can just bridge this gap, this literally existing gap, which was intentionally made by the designer. The designer wanted to create two environments and didn't think about the future scenarios which are coming. So we came together, we were just a kind of advisor in this process rather than the thinker of the solution. My point is also that not all the time we should be in the role of a steering committee, but sometimes we should be just an advisory committee, you see. And in this process, we were just helping them with the methods, with the don't and real don't and do's that have everything to do with the reliability. So except that part, and we were also a creative partner together with some partners from the art sciences. So we developed a totally new concept, a mobile movable art concept, I would say, that at the moment has been used by the inhabitants for a couple of times, in different exhibitions or neighborhood gathering that they have. Bottom line of the story, how we can encourage that one. And there also we use the technology, the augmented reality. It was not time to explain it, but the augmented reality we use just to get the opinion of people about their own environment and to give the people equal capability to discuss with us as architects, as designers. The story that what I want to say is that it's not always about short-term impact that we are creating. Sometimes it's about education. The matter and the point that you as a designer bring the subject up and discuss that one, even if it's not at the moment realized, it will be. As you know, we need to open the doors of the care homes in the Netherlands for senior citizens with dementia to go outside. So that one is impossible to do without technology. So sometimes also the clients of yours are forced by the, policies and other contextual matters that they are running them. The very first step is education, and you are doing a wonderful job.
Thank you.
Wonderful. We have a question from Raymond. I'm going to read it out loud quickly. As a building company that focuses on healthy building with natural materials, are there solutions for the elderly that we can incorporate at the moment? Because I think we've talked about the time span and so on, and things being in the research phase at the moment. And what's your take on that? What can you use at the moment already?
Right. I'm giving answer, Anja, if you have something else, I will hear it. In my opinion, dear colleague, yes, there are plenty of good solutions that you can use and already have been used in the Netherlands, at least I'm sure about it, in the care homes or even in the cities. So when it comes to somehow how keeping an eye, and monitoring of people, plenty of systems are being used, and they have to, because these people are living alone, and it is not responsible to leave them with their situation alone. So the current situation is that many products are in the market that they could observe and see when the critical moment arrives, if somebody falls, or for example, if somebody is lost, and so the system calls for a person and for help. These are there. What I wanted to achieve, and that is what I'm saying, that the knowledge from my research program is hopefully of added value for the science, is that we are not just going to be passively watching them, but actively are going to engage them in the process that they themselves could solve the problem. And that is where we need to still to work on. So partly it's already there. So if you have natural environment and it's not yet smart enough to observe, monitor the behavior of some people, please do so. Please do so.
Yeah, and I think also the word natural materials is interesting in this, because we just finished the research with natural materials in, well, high care environments, which have quite high demand in solutions with it. And well, there are solutions like and many options also, like Masi said. But in the natural materials, there is still a way to go, I see as well.
You see, you have this paint. If it's made of the natural material and you put some small sensors, and these are very, very much in developed, and my colleagues at the TU Eindhoven, they have wonderful, small, almost microscopic sensor technology. We could put it in the paint. We just paint the whole wall, and then we have a smart home, and then we can guide or whatever what we can at the moment, observe of anything. We can do that. So it's about you have the knowledge of how that should be done in the environmental friendly way, but also this knowledge could be also somehow human friendliness. We could get into there, and then we get it a care preparation for a caring environment, I would call it, without saying that we are yet there, as I said, because I think absolutely that when we passively do things, we are not caring. When a good architecture is there, then we can talk about that the environment could care. So we need to do that, and we need the basis all should be there, but they should become also intelligent, I do think.
To wrap it up, maybe, is there any research that you'd like to share, any links or anything that people can look up to, can do their own or continue their own research after this talk?
Sure. I am sharing the screen. There is a website, and I'm putting also the website into I'm in the chat room. If you feel like, you can always call and also contact the researchers who are working on the matter. But it calls Deal Academy. I see that I don't have it here. And we have this international conference each and every year, also this year, in next month, literally next month, we are gathering in Istanbul, and we have this proceedings are online, and the website is she2025.com. But also I'm putting the website here that you can find it. It calls Deal Academy.nl. So if you go there, you will see plenty of projects there which are developed together with the practice and the either postdocs, PhD students, or together with the practice, we are working on the matter together. So if you go there, please, then you will find it.
Is there any research from your side, Anja, that you'd recommend for people to look up?
I can share some links later on in when it's shared from the last project that I've showed, scientific research, which would be really interesting, and a lot of things are found on our webpage as well. So it could be a good starting point as well.
Perfect. I don't know if there's time for any further questions. Maybe I can do one last one, just because I'm curious about the timeline, as I have an advanced training in futures thinking, and so I'm looking into timelines and speculations and scenarios and so on. And for me, it would be very interesting to see your opinion on how fast or how much in the future can we project these scenarios to happen? When do you think these technologies will be market ready to have a fully smart home as a common ground, let's say, in the interior? And also, maybe that's connected to the question, what do we as interior architects and designers need to do to get there?
Right. Two key questions. I start with the first one. The last one I leave to Anja. She has lots of experience on that. But the first one, I genuinely believe that we are almost there. So in my research agenda, I'm talking about 2035. So within rather less than 10 years, we should be there. As it goes very, very fast, developing the neuroadaptive buildings and more understandable building. As I mentioned earlier, also as an answer to the former question online, people who are online, some parts of the matter is already there and has been used. Some parts are being used by the care homes, at least in the Netherlands. But I'm sure that when it comes to matters like smart meters, which is not related directly to health, but it's more related to energy, it has been for a longer time in use in at least in our country. So in my opinion, there is just one way. We don't have enough people. We don't have enough equipment. There is no money almost nowhere. Everywhere we have this. So there are many people who need now, and especially in the future, this help. So there is one way, trying to make it feasible.
Yeah, in terms of from the design perspective, it's very important to keep your own knowledge up to date and to be upfront, to know what's happening, so you can inform also clients and projects. I think that's a key element. That you start informing them and implementing things that are already there, or try to experiment, or also new technologies or new options to share them and to inform. To show it and give best practices as well.
I find it very fascinating to think about what how this might impact interior education, how we can, apply principles such as lifelong learning to really have, workshops on a regular basis and so on and so forth to get this technical knowledge, but also to always kind of recall how this is a very fundamentally empathetic job that we do, right? And I find it very interesting to think about it in that sense, and also that like how can you put yourself into the shoes of the end user? I think also from an ethical point of view, I find it very, very relevant questions that are probably only going to grow stronger in the way on how we deal with these things. So on that note, we could probably sit here forever, but I find it very interesting. Thank you very much for your insights, both of you, Masi and Anja, for your expertise, for your time, for your insights, and your empathy and skills that you bring into this discipline, which I find very enriching and inspiring. So thank you both. You will find this session on YouTube later on, and also on the Atlas archive, which will be released on the 25th of April. So stay tuned. We can't wait. And have a great start into the week, everybody.
Thank you.
Thank you for inviting us.
Thank you.
Thank you for being online. Goodbye.
Bye-bye. Thank you.
Thank you.